I'm joined today by Dr. Leslie Hayes. She's a family practitioner with El Centro Health in Espanola. And Dr. Sanjeev Arora is founder of Project Echo at the University of New Mexico. Thank you for joining us on New Mexico in Focus virtually. Dr. Hayes, what do things look like right now in Espanola and northern New Mexico generally? How high is the concern level about COVID-19?
I'd say the concern level is appropriately high. So far, we are lucky that we have not had a lot of cases here in Rio Arriba County. I think last time I checked the DOH website, we had 10, and no deaths yet. Nonetheless, I think part of the reason our numbers are low is because people are responding appropriately. I have been so happy when I talk to patients. People are taking this seriously. They are staying home. Part of it is because Espanola has such a strong knit family structure. People have folks living at home who are elderly or who have chronic illness, and they want to protect them, so they are taking this seriously.
And is testing available readily in that area?
Yes. Presbyterian Hospital in Espanola, Pres has made a real focus of making sure that testing was available at all of their sites. So we have been able to test in Espanola very early on. We've had testing available. As a matter of fact, last week I did a test on a patient of mine who's going in for alcohol rehab. No symptoms and no exposure, but the rehab was requiring a test before he could go in, which I thought my friends in other states are telling me that they cannot get testing on patients who are symptomatic and have had exposures, and that I could get some testing for someone. It's clearly appropriate. I mean, this was a great thing to be able to get this test. I got it done Friday afternoon. I had the results by Sunday morning. So testing is readily available and we are doing well. So
that's very fast. That's faster than I've heard in many places.
Yeah, no, I am told that it only takes them 4 hours to run the test, but that the big delays, first off, just getting the test down to Albuquerque takes time if you're out in the hinterlands. And then there was a backlog for a while, was why it was taking 5 to 7 days. But as far as I can tell, they seem to have worked through the backlog because it has not taken longer than 48 hours for any test I've run in the last week or two. So
we have heard a lot about COVID-19 outbreaks and the response and playing out in New Mexico's urban communities. But what is your day-to-day experience like in Espanola right now?
So the big thing is barely anyone is coming into clinic anymore. We're doing almost all of our visits over telehealth. And that's been kind of a mixed bag. I am so grateful that I am still able to provide care to my patients. It is not, I don't feel like I'm doing quite as good a job most of the time over the phone providing that care because I can't see them and it's harder to talk with people. There are definitely times where the telehealth has turned out to be a little better. Telehealth is nice if I just need to check in with somebody a week after starting a medication. It's really great to be able to just schedule an appointment, check to make sure they're not having side effects and see how it's working for them, and that we're actually getting reimbursed for that, which has been lovely. We are realizing we did a lot of our visits over telehealth even before. I would say probably at least 20% of my visits were telehealth, but we were never paid for them before.
That's interesting. That changed because of this?
Yeah, so they are paying for telehealth visits now.
Mm-hmm.
There's multiple other ways. We're screening everybody's temperature first thing in the morning, all of the staff, and then we're screening all patients before they come in, both for everybody. We're screening for temperature, for symptoms of COVID-19, and for exposure to COVID-19, and trying very hard not to have anyone in the building. The hospital, again, I'm so grateful to Espanola Hospital. They have been great. They agreed to see anyone we were concerned about COVID-19. They have a special clinic where they have the proper protective equipment, and they do the testing at that clinic as well. So we're all wearing masks. I'm in a closed room is the only reason I'm not wearing a mask right now, but otherwise we're pretty much wearing masks full time. And the only people we're seeing in the clinic, we are seeing babies for shots. I'm seeing pregnant women intermittently to, sort of measure and make sure everything's going well. And then occasionally you'll have somebody with a rash or an abscess or something you just can't do over the phone.
Is it financially challenging if we're hearing this around the state because there's no elective surgeries right now? People are not going in for much of anything because of state orders. Is that difficult financially for you folks?
I think we're actually holding steady with the telehealth. We would be in real trouble if they not approved payments for telehealth. But primary care is still pretty essential. And so being able to do it over the phone means we can keep our patients safe, we can keep our staff safe, but we can still make sure that people get the care they need. I mean, people still need to be taking their blood pressure medications. They still need to be monitoring their blood sugars. They still need to be taking medication for opioid use disorder. All of these are really important. And I think if we don't make sure that patients get care during this time, we're going to see a huge spike in conditions and deaths after things have settled down with COVID, when people's out of control blood pressure starts to hit. So like I said, I don't think it's quite as good as seeing them in the office, but there's still a lot we can do to make sure that they are taking care of themselves and getting the care that they need.
And as a frontline medical professional, what's your biggest concern right now in terms of personal protective equipment and having enough ventilators and other resources?
So for me personally, my biggest fear actually is of getting COVID-19 and not realizing it and passing it on to patients or coworkers. I mean, that is actually what I worry about the most. So the personal protective equipment is important both because I don't want to get it myself. And it's interesting because people talk about the death rate. What really scares me about this illness is not the death rate as much as the critical care rate. It has much higher rate of critical care than almost anything else we have ever seen. So that really scares me. And making sure we have the N95 masks, and then, the gowns and the gloves and the face shields if we're dealing with someone who is likely COVID-19 and possibly going to aerosolize, which is something like a cough.
Dr. Arora, I want to turn to you. You created Project ECHO as a telehealth model. It started here at UNM and now is spread across the US and globally. And the idea is pretty simple. You use the web conference technology to put specialists in direct contact with medical personnel in rural communities, which often have only primary or general practitioners like Dr. Hayes. What are you all doing specifically during the COVID-19 outbreak to help with these response efforts?
We've been doing ECHO for 17 years, and over this time, we have built it into a large network, which consists of about 850 separate programs, which are operated out of about 394 academic centers in 39 countries. And the learners are currently about 100,000 learners learning in 153 countries for about 70 different disease areas. And this was going on for many years until all of a sudden we were faced with COVID-19. And once we were faced with this problem, the first order of business was for us was, how can we use the ECHO model to train New Mexico clinicians, healthcare workers, nurses, medical assistants, doctors, nurse practitioners, physician assistants in many, many different areas. So we partnered with the Secretary of Health, Kathy Kunkel. We partnered with the Secretary for Human Services, Dr. David Scrace, and other members of their departments. And we actually first launched an ECHO with them, and we were completely swamped in that more than 1,000 people joined, and we ran out of capacity, and we realized immediately that the demand was just enormous. So as soon as that happened, we realized we had to do a lot more. So in collaboration with the executive branch in New Mexico, we have now doing 7 separate ECHO projects every week, 7 separate clinics. So we have office hours for doctors. We have training sessions for first responders. We also have an ECHO project on resiliency, because a lot of healthcare providers are experiencing extreme anxiety and worry. And some worry is because of their patients, some about protecting themselves, others for their mothers and fathers, that they could take this infection back home. All of these things are a matter of great concern. And so we have an ECHO for resiliency. So 7 times a week, we get people together, people from all over New Mexico join, and we discuss cases. They present patients that have it, or they discuss problems such as how should they manage when personal protective equipment is not enough, or how to interpret laboratory testing. And then we partnered with Tricor Laboratories to come on as experts. And the state experts in the Division of Epidemiology and etc., all participate as experts in these calls. And the office hours are run by our infectious disease specialists at the University of New Mexico who are managing the COVID-19 patients in the university hospital. We have a lot of COVID-19 patients in our hospital. Our ICU is packed with them.
I know you can't do things like you can't create more ICU beds or ventilators, but talk about how this Project ECHO model helps in the overall response. Why is it so important?
So there are two basic aspects of the work we do, Megan. The first is the whole world needs to amplify the public health response. So there are best practices on how to isolate patients, how to trace contacts, how to set up laboratory quality systems, how to increase the number of tests available, whom should you test? If you have limited testing, when you have limited personal protective equipment, who should get it? How should you reuse it? How should you on and off it? We call it donning and doffing without infecting yourself. And a variety of systems of that sort, when to open businesses. So we have echoes around all of that, amplification of public health response. Then there is this issue of amplification of the care response. And Dr. Leslie Hayes, who is an echo provider, I'm proud to say, she, her colleagues want to know how to protect themselves, how to do a clinic so that other patients don't get infected, how to do a telehealth consultation, how to, when to admit, when to manage at home, when to call to the clinic, and how to treat at home, in the clinic. And then there is a whole group of doctors for which we have a separate echo clinic on Thursdays in New Mexico, for example, for inpatient doctors, how to manage people in ICUs, ventilators. In low-income countries, people are talking about how to not use the ventilator when you don't have enough. How do you use other kinds of machines to support patients? And even in some cases, they talk about how to share ventilators, one ventilator for 3 patients. That's very suboptimal. We don't recommend it. But there is all kinds of different things. And then the last part of this is, Megan, new research is coming out at the rate of 100 publications almost every day. And how does a doctor like Dr. Leslie Hayes keep up with all this? So we have teams that assimilate all this research and then present it practically on a daily basis to clinicians all over the world so that they don't have to go searching for this information.
Well, as we wrap up, I wanted to ask both of you, what is something about the fight against the spread of COVID-19 in New Mexico that you want people to know that they may not already know or be able to see and understand?
Go ahead, Leslie.
So this is totally non-medical, but I want to say I've been so grateful for the response of the community. People have made us hundreds of cloth masks that our clinicians are wearing, and also that we are giving out to people in the community to wear when they go to Walmart or to the grocery store. And people are really coming together around this, and it's just been heartwarming to me that people, care about doing the right thing. And I just think that has been an amazing thing to see. I'm so proud of my community for that.
I'm extraordinarily grateful for the leadership that the state of New Mexico executive branch is providing in this setting. They were we declared a state of public health emergency when there was 1 patient in New Mexico. That was a very visionary and a courageous act on the part of our governor. It wasn't an easy thing to do, to really start locking down when you have so few patients. The enemy is invisible. No citizen can actually see the virus. And it's hard to make sense if you are not a physician. Why does it make sense to lock everything down? But the result of that foresight and getting the testing that we need. So we have tests in New Mexico, which in New York, they still don't have it. Just over the weekend, I had a patient in New York City who called me for help. And she had symptoms of COVID-19, went to a clinic there. I connected them to a clinic to go, and what they were told was there wasn't a test, they should just quarantine themselves. So to build up the testing capacity, to really reinforce our public health, it gave us time. And I think that has really been a tremendous boon for every New Mexican.
Thank you both so much for talking with us about this, and please stay safe as you continue your important work.